Hi, my name is Faye Hines, and welcome to my Key Assessment Case Study presentation. First, a brief outline of what's going to be discussed during this presentation. Jane, our patient's dietary assessment, recommendations based on this assessment, and then a 3-day menu to meet Jane's nutrient requirements. So what do we know about Jane? Jane is a 14-year-old female. Her health history indicates that her BMI for age previously placed her in the overweight category, but her BMI for age has recently progressed to the obese category. Her weight has been increasing by 10 to 15 pounds each year for the last 6 years. And Jane's condition is particularly disconcerting because her progression from overweight to obese shows that she has not been able to effectively manage her weight. Her family history of parental obesity and paternal type 2 diabetes also increases Jane's risk for obesity in adulthood and poses an imminent risk for developing type 2 diabetes. So Jane's nutrition assessment. BMI was calculated based on the following formula: weight in kilograms divided by height in meters squared, and based on this calculation, Jane's BMI is 28. Normal or healthy weight status is based on a BMI between the 5th and 85th percentile on the CDC growth chart. When Jane's BMI is plotted, her BMI for age is at the 96th percentile for girls aged 14 years. Seeing as her BMI for age is greater than the 95th percentile, she is classified as having obesity. Her stature for age is at the 33rd percentile, which indicates normal stature, and her weight for age is at the 93rd percentile. So weight for age reflects body weight relative to age and is influenced by recent changes in health or nutritional status. This measurement can't be used to classify Jane as overweight or obese. However, it is important for monitoring weight and helping to explain changes in BMI for age in adolescence. Jane's nutrient needs are based on the following criteria. She's female, 14 years old, has a BMI of 28, and a sedentary lifestyle. I'm just going to quickly touch on her macronutrient requirements, and we'll discuss the micronutrient requirements in more detail later on in the presentation. So the acceptable macronutrient distribution range for carbohydrate for Jane is 213 grams to 307 grams. For fat, it's 53 grams to 74 grams, and her recommended daily protein intake is 59 grams. Based on the chronometer reports for Jane's 3-day food diary, there are some obvious consistent inadequacies in her current diet. Firstly, for all 3 days, as anticipated, Jane's total energy intake was excessively high. Her total caloric intake based on age and BMI should be approximately 1,890 kilocalories per day. Chronometer revealed that her total daily caloric intake is on average 800 to 1,000 kilocalories higher than it should be. Jane's excess energy intake is the fundamental concern as it's the cause for her accelerated weight gain. Her total carbohydrate and fat intake is consistently significantly higher than it should be. A large amount of Jane's carbohydrate intake is sugar, and excessive sugar intake in adolescence is associated with an increased risk for the development of cardiovascular disease as a result of increased energy intake, increased adiposity, and dyslipidemia. Jane's intake of saturated fat, cholesterol, and trans fat is proportionately high, and decreasing her saturated fat, trans fat, and cholesterol intake will be an important focus of her new dietary plan in order to decrease her risk of cardiovascular disease. Jane's sodium intake is also extremely high, between 300% and 400% of what it should be daily. Excessive sodium intake is linked to hypertension and increased risk of cardiovascular disease and stroke. Jane's 3-day food diary also revealed some important micronutrient deficiencies. Her vitamin D and E intake is consistently low. Specifically, her vitamin D intake is less than 30% of the DRI, and for most days, her vitamin E intake is less than 50% of the DRI. Vitamin D deficiency causes skeletal deficiencies and growth retardation and increases the risk of osteomalacia and muscle weakness. Vitamin D is also implicated in calcium phosphate homeostasis and the prevention of cancer, autoimmune conditions, cardiovascular disease, and infections. Low intake of vitamin E can increase the risk of developing atherosclerosis and other degenerative diseases. On only one of the reported days, her iron intake was significantly lower than the DRI, approximately 50%, so I actually didn't include this as a nutrient deficiency. Consistently low iron intake, however, would put Jane at an increased risk for developing iron deficiency or iron deficiency anemia. Jane's potassium intake was inadequate on most days, in addition to her fiber and vitamin K intake. Adequate potassium is necessary for maintaining fluid volume inside and outside of cells, and subsequently cell function. It acts to attenuate the rise in blood pressure in response to excess sodium intake and decreases bone turnover and the incidence of kidney stones. Adequate fiber is necessary to help regulate blood glucose levels and to prevent constipation. And vitamin K is crucial as it is a coenzyme during the synthesis of many proteins and has a role in blood clotting and bone metabolism. It's important to note here that there may be some inaccuracies, that the food chosen for the purposes of the chronometer report may not be exactly what Jane ate. We must also consider reporting error on Jane's behalf. Jane's lab results are normal with the exception of her fasting glucose, her high-density lipoprotein cholesterol, and her low-density lipoprotein levels. Her fasting glucose of 116 milligrams per deciliter indicates that she is pre-diabetic. And her lower than normal HDL levels and abnormally high LDL levels, likely attributed to her high blood glucose levels, sedentary lifestyle, excess weight, and high saturated fat intake, put Jane at an increased risk for developing heart disease and stroke. Based on this information, let's move on to the recommendations. Jane's intervention should focus on diet, physical activity, and behavior change based on the fundamental principles of decreasing caloric intake and increasing energy expenditure. The dietary component of the intervention will focus on decreasing her total caloric intake and limiting her fat and sugar intake by focusing on consuming foods from all food groups. A balanced diet based on the 2010 to 2015 dietary guidelines for Americans will help to address the micronutrient deficiencies caused by Jane's current diet, as well as help to decrease those micronutrients that she is consuming in excess. The dietary guidelines for Americans emphasize eating a variety of vegetables and fruits, whole grains, a variety of lean protein foods, and low-fat and fat-free dairy products. It also limits eating foods and beverages with added sugars, solid fats, and sodium. Recommendations will also be made regarding Jane's physical activity. It's recommended that Jane accumulate at least 60 minutes or 1 hour of moderate to vigorous physical activity per day. It does not have to be completed in one session. She may benefit from joining a recreational sports program at school or walking or riding her bike to and from school daily, if possible. Involving her family in daily activities, such as playing with her younger siblings or walking, would also be beneficial. Jane's intervention should also include behavior therapy aimed at changing her thinking and subsequent actions, specifically in association with dietary intake and eating, physical activity, and sedentary behaviors. It would focus on improving self-efficacy for dietary change and self-control, promoting a healthy food relationship, and building self-esteem. Part of Jane's intervention would also include education on healthy eating, such as how to effectively use My Plate so she can begin to make educated food choices to achieve caloric balance. Jane's parents should also be educated on creating a healthy food environment and how to prepare low-cost, nutritious meals. They should also be encouraged to join Jane in healthy eating and physical activity to help them manage their own weights, but also to provide a more supportive environment for Jane to do so. Jane's parents have reported that they often ran out of money for food before the end of the month, so it's possible that Jane's family may be eligible for the Supplemental Nutrition Assistance Program. If so, participation in this program would be highly recommended. SNAP provides assistance for eligible low-income individuals and families, and SNAP benefits may help Jane's parents to create a healthier food environment by increasing their food security. Other government nutrition programs that may be beneficial to Jane are the National School Lunch Program or the School Breakfast Program. Participation in these programs, if they're offered at her school, would be recommended because not only does this guarantee that Jane receives at least 2 meals daily that meet federal nutrition standards, but it also decreases the amount of money that Jane's parents must spend on food daily. Subsequently, this would increase the amount of income that can be used to purchase more nutritious foods at home. Jane's 3-day meal plan took into consideration all of the aforementioned recommendations. It is based on my plate and ensures that with the correct guidance and education, Jane will be able to successfully eat a dietary pattern that parallels my plate recommendations. Things that were also considered when creating this meal plan were cost. Economical foods were chosen, particularly when it came to protein sources and fruits and vegetables. Economical protein sources that were included were lean ground meats, beans, and canned tuna packed in water without salt. I avoid using more expensive cuts of meat such as skinless chicken breast and salmon. Although great protein sources, they are not necessarily a viable option for a family of lower income. In terms of fruits and vegetables, I incorporated frozen berries, bananas, and apples, and lower-cost veggies such as celery, cucumbers, and carrots. I also considered familiarity. I tried to incorporate foods that were not too novel for Jane, foods such as popcorn, which she enjoys, and healthier versions of burgers. I also considered that Jane is part of a family. Her parents have already indicated that they have limited time to prepare meals, so preparing a separate meal for Jane is not only not feasible, but also not appropriate for her to be successful. I tried to think of meals, particularly dinners, that could be shared and enjoyed by the whole family. I also took into consideration convenience, focusing on healthy meals that are quick and easy to prepare so they become the most viable option. And finally, the elimination of fast food, sugar-sweetened beverages, and sweets. So day 1 of Jane's meal plan, her breakfast is similar to a breakfast that she had during her 3-day food diary. So 2 eggs fried in 1 teaspoon of fortified margarine and 2 slices of whole wheat bread, higher in fiber and higher in other nutrients, with 1 teaspoon of fortified margarine and half a banana. For snack, 1 medium apple and 1 cup of yogurt that's also low fat. And then for lunch is a tuna sandwich with whole wheat bread, water-packed tuna, and 1 tablespoon of mayonnaise. And then on the side, some vegetables, cucumber, celery, and to drink, low-fat milk. For her snack, 5 whole wheat crackers, so again, more fiber, and 1 tablespoon of natural almond butter, so low sugar, a good source of protein, and healthy fats. And then for dinner, a spin on her Big Mac that she ate during the first day, which is a homemade burger made from extra lean ground turkey, and on the side is a garden salad with fat-free dressing. And then day 2, breakfast is very economical, easy to prepare, half a cup of oatmeal cooked with water, half a cup of frozen blueberries, which are more economical than fresh, and 1 cup of 1% milk. And then for snack, an apple, and then lunch, an almond butter sandwich, again with the whole wheat bread, so a good source of healthy fats and fiber and protein, and then 1 cup of 1% milk. For snack, veggie sticks, so carrots and celery and cucumber, and then to dip, low-fat yogurt. Dinner is eggs, so an omelet with lots of vegetables, easy to prepare, high protein and economical, 2 slices of whole wheat bread, and 1 teaspoon of fortified margarine. And then finally, day 3, again an economical breakfast that's very quick to prepare, 1 cup of shredded wheat with half a banana and 1 cup of 1% milk. For snack, it's celery and almond butter, so a good source of fiber and protein and healthy fats. Lunch is an apple with a tuna sandwich. And then snack is 1 cup of low-fat plain yogurt and 3 cups of air-popped popcorn with 2 teaspoons of melted fortified margarine. So this is a snack that Jane has indicated that she likes. It's just a healthier spin on it. And then for dinner is a fun salad, a taco salad that everyone can enjoy, made with the same low-fat turkey that was used to create the burger on day 1. So economical, you can use leftovers, so it's even faster. Lots of veggies, also incorporated some chickpeas for some added fiber and iron. 1.5 ounces of shredded cheese as a dairy serving, and 1 tablespoon of fat-free dressing. So that concludes my presentation on our case study about Jane. I hope you learned a lot and I hope you enjoyed it. Here are some of the references that I used that you can look up and research further. So thank you.